family for coming together. You know, I have spent all my life, I need to tell you a story, all my life trying to understand black people. And it started with my birth. When I was a child, I'm 70 years old. My mother worked, as most black people did in those days, doing some kind of nasty work that white folks didn't want to do. But she did it at a insane asylum in Massachusetts. And I was also born before there was television. And so my mother would come home and entertain my brother and I with stories. And she told us these great stories about her family fighting white folks in Georgia and South Carolina and making people respect our family, which planted a seed in me. She also told me about coming home and how it was so strange that at this insane asylum, the white doctors were more crazy than the black patients. That planted a seed in me. And so she talked about that we needed to have something to understand the, in quote, psychology of black people. I'm a child, I'm 4 years old. And she's telling me these stories. And so I believe, as is the tradition of Ifa, which is a Yoruba traditional religion, that we make an agreement with God to come to the earth to do a particular thing and to do it well. So I believe I came to this earth to be the best black psychologist I could be in the service of our people. And in doing that, we established many things. Some of you know, and some of you probably are my students of that. I'm amazed. My wife and I walk around and we see these old people saying, Dr. Nobles, you taught me. And I'm just trying to realize what this means. I'm not talking, or that you taught my grandmother. I mean, it's just really some amazing kinds of things. And I say that to say that this is not a quickie. This is not a drive-by. That we are really doing some serious work here, and I think this effort is going to be the capstone that tops the pyramid of our healing. And I say that because I want you to recognize how significant and important you are. It ain't, you know, it ain't about me, it ain't about other folk individually. It's about us working together as a family. As a sidebar, the powerful African American Steering Committee you see was originally, and Pastor George, was originally the county wanted to establish a black advisory board. And we push back on that. It means that we don't want to be no advisor, because we can advise you stuff and advise you on your agenda. We want to have a steering committee that runs this stuff. And that's what the steering committee is. They're not behind the wheel. They're not on the sidelines advising white folks or the system or the programs about what they can do better for black people. They are steering this train to make it better for us. I thought about this in some depth here. That I was taught a lot of times, you want to be really innovative, you have to think outside of the box. And people pump this chick, well, think outside the box, be innovative. And I thought about that a lot, and I said, well, you know, that's not our solution. Our solution is not to think outside of the box. Our solution is to think deeply within our own pot of gumbo. Yes. Take that symbolism very carefully. Our own pot of gumbo. And if you all know, and I'm not, I think we cook, some people don't. But when you make gumbo, you put a bunch of stuff in it. You put some carrots in it, you put some chicken in it, some fish in it. But the most critical thing in it is the okra and the gumbo filet. You don't have okra and gumbo filet in it, it's just soup. And it could be carrot soup, it could be fish soup, it could be chicken soup. And so each of us is an ingredient in the gumbo. Each of us, so if you're a carrot, don't think the whole program is going to be about carrots. If you're chicken, don't think the whole program is going to be about chickens. You are adding something to the gumbo. And the most important part of the gumbo, again, is our okra and our gumbo filet. For us, as we are talking about this restoration of our wellness, another idea thing, we're engaged in the restoration of African people's wellness. And engaging that, the most critical ingredient is the okra and the gumbo filet. For us, the okra and the gumbo filet is our culture. That's the gumbo filet, African American culture. So we've got to build on this really respect and honoring of what it is to have a culture. Because too often we've been taught that our culture is either inner city blues or gang banging or from slavery. And so we got to do the work to rescue our culture so we can use it. And the second thing is that the okra, for me, is the science. Hear this word, the word. The science of African American human functioning. All these systems that purport to be healing us and working with us don't stand on the science of our human functioning. That's black psychology. I'm just going to come out. Look, we have 35 or 40 years of black psychologists from around this country writing, researching, studying, engaging in practice, that when I did a survey of Alameda County behavioral health care, people couldn't even name a name of the critical people. So we're going to take our okra, African American psychology, black psychology, take our gumbo filet and make our think deeply in this gumbo. That means each of you is critical. We are going to, I think the director of this is going to talk a little bit about the design of it. But I want you to see that this is an effort that is on the cutting edge of the entire nation. And as I go around, I go around and I talk to people throughout the nation. I ask some people who are the big dogs, the big folk, would you help us in this? Would you help us in this? And major people agreed to be on. We've established a national advisory board for the design of the hub that consists of seasoned elder scholar practitioners. And they're right now working with us on helping us design. The former director of Meharry Medical School's International Healthcare is on our board. The past president of the Association of Black Psychologists is on our board. The national prominent African American dance instructor. See that? It ain't about just mental health people, it's about all kinds of. We need to have the folk who are in the barbershops talking to us. We need to have the folks who are doing the dancing and healing, dancing and drumming to talk to us. We need to have the clinicians talk to us. And so we're going to engage in a conversation of black talk. Of black talk.
Yes.
Black folks come together and talk about what is our prevailing problem. Remember, you might be a carrot. So don't think that your carrot is the whole problem. Your carrot is adding something to the gumbo. We're going to talk to barbershop people, we're going to talk to gangbangers, we're going to talk to veterans, we're going to talk to professional folk about what is the issue for us in terms of restoring our community to wellness. That's what it's about. Restoring our community to wellness. The scholars, what it's about. You might be a potato. Don't think that the whole game is about potatoes. You're just an ingredient in the gumbo. But we need you because you all know, I think you know, that when we put all that stuff together and we let it simmer, that gumbo starts mixing together and the carrot adds something to the potato. And the potato adds something to the chicken. And the chicken adds something to the fish. And before you know, we get something that's so distinct and so great that you can't say this is just potato soup. This is gumbo. You all are the ingredients of our gumbo. Think deeply. We give you a handout in your packet about the African American design. Look at it, read it, then ask yourself, how can I contribute to the conversation? We're going to have afternoon conversations, we're going to have national conversations around focus groups and experts, one-on-one key informants about what we need to do. See, I've been teaching black psychology for over 35 years. And I'm appalled that those folks who claim to be providing our community with services don't know nothing about black psychology. They work with black folk. I've been a director of a black family research institute that Dr. Goddard mentioned for over 35 years. And no one has said that we put family first. That's our way. We put family first. And our first responders is not the police, it's not the firemen, and all the people are good. Our first responder is mama, is big mama, is mud, is my dad, is daddy, is the folk that sit around the kitchen table that say, wait, that my folks did with me. Something strange about that boy. And we got to do something and work with him. And that's what we need to do. You all are the family. And it goes beyond it. You are not the only part of the family. It goes beyond it. There's some rice out there we got to talk to. There's some peas we got to talk to. There's some corn we got to talk to. We got to talk to all these people and then pull that together with your genius. And I hope you're here. We are engaging in a major black talk, a major conversation with black folks about what are the prevailing issues And you've heard people talk about it until they take it with their own families today. What are the major issues that are impacting upon our wellness? And then how do we take our genius, the genius of black folk, and develop it into a solution that restores us, not rehabilitate, restore us to wellness. That's the challenge that you and I, and all of us, I hope, are committed to. So that equals go aside and say, we're going to make this right. We're going to make our people heal, because the activation of our self-healing potential is in us. It ain't in someone else. It is in us. Tap that healing potential.
But I'm so honored to be here, and to give those of you who may not know, I haven't had the privilege of crossing your path before. Again, I pastor a church in southern Alameda County, Family Bible Fellowship in Newark, formerly Fremont Bible Fellowship when we were in the city of Fremont. And I've pastored that congregation for 28 years. And I've been in the ministry for 34 years. And over those years, my passion and my heart has always been to our community and how to connect, keep our community connected to our communities of faith. And a number of years ago, I had the opportunity to join a train that had already left the station as related in our community in Alameda County as related to mental health within the African American community. And one of the areas that there was somewhat of a void there, and that was connecting mental health with the faith community, particularly the church. There was a study done a number of years ago, a poll done, and it was highlighted on a program by Soledad O'Brien. She had a series on CNN a number of years ago called Black in America. And one of the episodes focused on the church, the black church, the role of the black church within the African American community. And in the study, it pointed out, they asked, it was self-responded, the question was asked to African Americans across the board within our nation, how many of you identify yourself with spirituality or faith? And overwhelmingly, almost 90% of the respondents indicated that they consider themselves connected to a faith community. And then the poll went a little further, and it asked of all of the different denominations and different religious groups, which religious group do you identify with the most? And almost 95% identified with the Christian faith in the black church. And we can see, in one of the things, we have a training curriculum entitled The Bridge Over Troubled Waters. And you don't have anywhere to go on this Sunday. We have a Black History celebration at our church, 37620 Filbert Street, and the title of it is We've Come This Far by Faith. And in the training, we have some exhibits and so on, but we chronicle the historical development of faith within the African American community from slave ships to the White House. And our goal through this whole commitment, again, getting on this train long after it had left the station, was statistics show that individuals, when they face any type of a crisis, but particularly mental health crisis, across the board, black, white, and different, they turn to their faith community first. But the challenge within the faith community is that generally within the faith community, mental health has been a taboo issue. How many of you agree with that? In the faith community, only 3 people, let me see your hands, how many of you agree with that? There you go, a little more. It's really been a taboo issue. And generally what happens is within our communities, we demonize mental health. Very compassionate and caring when it comes to primary health. But we operate from a position, generally speaking, a position of ignorance when it comes to mental health. And the one thing that I know about Christ and the community, sometimes you can find individuals who may have an issue with Christians, who may have an issue with the church, but very rarely will you find an individual who has an issue with Christ. They may have an issue with the church, they may have an issue with Christians, but very rarely do you find individuals who have an issue with Christ. And one of the reasons why is because the word that is closely connected to him is the word compassion. The word compassion. And that word comes from 2 different terms. The prefix is companion and the suffix is passion. And when you study his life, he was a companion of other people's passion or pain or heartache. He never saw himself disconnected and viewing individuals' pain from the outside, but to be a companion of someone's passion or pain is that you walk in their shoes, you walk with them. And that's the legacy of the African American church. And Dr. Cornel West wrote a book once called Race Matters, and he cites one aspect as it relates to the church, or as it relates to the African American community, and then I would add an amendment to that chapter. On one aspect, he talks about the difference between the African American community today, right, the writing of his book, and then the difference between the African American community prior to the writing, particularly during the Civil Rights era. And he talked about the significant role and impact that African American leaders had within the community. But then he talked about how when we began to taste a success in the aftermath of the Civil Rights struggle, a phenomenon occurred called Black Flight. And that meaning that many African American middle class individuals abandoned the community. Not only did they move geographically, but they took their expertise, they took their struggle, they took their stories from the community to blend in and to assimilate into suburbia. And the result has been a dearth of African American leaders who have been impacting our community. Then also, secondly, I would amend his chapter if he gave me permission to, and I would also say that the African American church has abandoned the community. Now, speaking in generalities, not individually, but in generalities, because the church in certain instances got caught up in materialism, got caught up in building empires, whereas in our roots within the church, we were identified with impacting the communities. That's where the schools came from. That's where the colleges came from. That's where the businesses came from. That's where the education came from. But as we began to focus more on buildings, we forgot about building people. And so one of my commitments is we developed a program here in Alameda County called Mental Health Friendly Communities, and the intended purpose is to connect the faith community to the community, and then also those who provide services to our community to also build a bridge so that you then will be able to connect to the community in which the roots of faith and the roots of spirituality run so deep and run so wide. And so I want to encourage you that if any of you are members of a church here in Alameda County, the county has made it possible for us to take our training, mental health friendly congregations, to any congregation within this county who desires to build that bridge between the faith community and the clinical community so that we can provide balanced and holistic care and compassion for our family members and our consumers. God bless you.
Good morning again, everyone. Can you hear me?
Yeah.
I'm Neisha Becton, and I'm actually the founder and the CEO for Pathways to Wellness Medication Clinics. What I would like to say today, a couple of things, and I know Gigi's saying we got to wrap this up, so I'm going to be brief, but I also want to share a little bit of my story and my journey with each of you. In light of Black History Month, I just want to say every day you make Black history, every day. So I would like to share a little bit of my Black history with you. I am actually the product of two parents from the South, Mississippi, in a small town called Clarksdale, Mississippi. Clarksdale, actually Tina Turner was born in Clarksdale, Sam Cooke, and Morgan Freeman. So it's a small town, it's very small, and my parents came from there. My great-parents were there too, in which they picked cotton for a living and lived on the plantation. So I had a very interesting line of history that I look up to and I follow, and I know I have to pave the way for my kids and their kids, and we keep going. I am very pleased to be a part of the African American Steering Committee because at first I was like, okay, let me see, what is this all about? Once I got on it, it's like I am totally committed to this group and helping to move and really remove a lot of the stereotypes that are out there. Pathways to Wellness. just to tell you a little bit of my story, I actually shared my story with the African American Steering Committee the last meeting, and everybody was so moved that they said, you have to share it today. And I said, okay, I would share that story. For those of you who haven't heard it, actually it was probably in 1999. I was working for an organization that was based out of San Diego, and I was their regional vice president of operations for 10 years, in which I traveled across the United States into 16 states to open up outpatient psychiatric facilities. My job was to contract with the hospitals, community mental health centers, medical groups who wanted to open up outpatient services. And our funding source was Medicare. So I spent the majority of my time in administrative law judge hearings, in which I represented the organization with our medical director. At the time, my regional medical director was Hiawatha Harris. We both worked for this organization. He had been there much longer than myself. I convinced the company, because I lived in Oakland and I saw a huge need for outpatient services right here in my backyard. So I convinced the company to open up what we call today medication support services. They didn't want to do it because they said it wasn't a lot of money to be made. The company was for profit, they were NASDAQ traded, the whole 9 yards. I convinced them to allow me to do it, and after 60 days into this project, it was really bleeding. It made no money, they were losing their shirts, and so they told me to go and deliver that news to Mary Thomas and Barbara Bridget. It was the longest flight of my life. I remember coming from San Diego saying, this is so crazy, I don't want to do it. I believe in this product. I know it's a service that we need in our community. I set these facilities up in Detroit, Michigan, Little Rock, Seattle. I was flying around at least 4 or 5 days out of the week to set these programs up. So I believed in what I do, and I still do believe in it wholeheartedly. As I got off that flight and went and shared the information with Mary and Barbara, one of the first things that they said was, you're kidding, right? Because this was in November and we were approaching the holidays and I was delivering a 30-day notice. I told them, no, this is for real. I'm really in disagreement with the decision, but I totally understand the company's position and all of this good stuff. They actually asked me, why don't you do it? For those of you who know Barbara, her exact words were, why don't you do it, kiddo? You can pull it off. And so I said, well, it's a lot of work. She goes, you've been doing this for 16 years. They've known me. They were great mentors. They watched me grow in the field. And I said, well, maybe I will. So went back to determine if I could pull this off as possible. Walk by faith, not by sight. There's many days that Dr. Harris tells me, have you looked in the mirror lately? When I have very challenging days, he tells me, don't forget where you come from. Right. Don't forget where you come from. So thank you so much for allowing me to share my story, and know that there is so much work to be done. We have to invest back into the community. We have to make sure that people are out there that look like our clients that are being served. We have that responsibility. Too much that is given, much is deserved, is what my grandparents taught me. So I know there's a lot to be done, and I'm willing to do it. One of the things I want to share with people, because we are a medication support service facility, please understand that there's a huge shortage in psychiatry at this time. Huge. So it's important to check out your doctors, make sure you're making the right decisions, but also know it's 91,000 psychiatrists. These stats are from 2013, so it's probably even lower now. 91,000 of psychiatrists in the USA. Out of the 91,000, 10,000 are child and adolescent psychiatrists. Out of the 91,000, 1/3 of those psychiatrists are even practicing medicine. Okay? They're professors or they're doing research. Okay? So, and out of that number is 1,500 black psychiatrists, African American. So, we have some work to do. Right. Our psychiatrists are aging out. The average age is 56 years old. And we do not have a lot of psychiatrists going into, students going into medical school for psychiatry. That's not happening a lot. So we're working very hard. I'm very pleased to have my brother who works very hard with me to do the recruitment. He follows people from their first year of residency until they get out. we work hard to really get the psychiatrists, good psychiatrists, so that you can vet and be pleased with our services. We still have a whole lot of work to do. And it's not a day that goes by that an African-American community member, a parent, a colleague will call me and say, Neisha, I need your help. I have a family member. I need your help. From politicians, you name it, I get those calls pretty much every week. And I'm very honored to be able to help this community and help people to stay healthy and stay well. We have to work on evidence-based practices. We talked about this in our committee last week. We need to work on practice evidence-based services that are inclusive of African-American people. Some of the tools that are out there, they don't apply to our people. They can't relate to that. So we do have a responsibility of improving the tools so that they include and look like services that our people respond to. One of the things, and I'll pass the mic on, that I'm working on right now is a collaboration with 2 African-American physicians out of Chicago, Albert Mensah and Dr. Bowman. And what we're doing is we're working on nutrient therapy, and we're also working on some other things outside of psychiatric medications. So we're partnering up, and they work, and both are actually students of Dr. Bill Walsh, for those of you who know him. And so they're all coming out to meet with me in a couple weeks, and we're going to really study the best type of medicines that work for this population, African American, as well as the nutrient therapies that have been proven to work, that they're actually taken into the prison systems. They have agreed to offer some free testing for our African American clients that we have. So I'm going to beat the bushes and figure out how to get this no matter what. It doesn't matter how many no's I get, it will happen.
Thank you.
Hi again, everybody. Noha from Roots Community Health Center. So I'm just listening to the distinguished panel and sort of hearing all the different themes that are emerging, and it's making me want to sort of talk about what I'm hearing and some of the reasons why I'm part of the African American Steering Committee. I think I'm the newest member, and I believe I was asked to join because of being a primary care provider that has a great deal of expertise in serving the African American community, and really also a history of advocating on behalf of our people and our community. What I heard a lot and what I experienced on the committee is really about connections, because I think people have asked me, what is this committee is it about? Is it about money? Is it about resources? Is it about, what is it about? And I think what we're doing is we're connecting faith-based, the providers, primary care, mental health providers, to the systems of care, behavioral health care services in Alameda County, leaders in the community, stakeholders, and we're able to make all of those connections and really come with a unified voice about what we're seeing are the gaps and how we can fill those gaps. Resources are important, there's no question about it, but I think, I remember hearing that in East Oakland where we're located, some of the investments that have been made are tremendous. $5 million a block. Someone did an analysis like that. Don't quote me, but I think it was something like that in a year's time. And if you don't have community infrastructure, it's like pouring water into a sieve. And what did we see from those investments? Very little. And so the connections to me are about us building infrastructure within our community. Who are our institutions? We're sitting in one, an emerging institution, and I loved hearing about the history of it and believe that this is an institution and will continue to be one that's rooted in community. We need more. And they need not be their own islands. We need to all be connected, right? So I'll tell you a quick story about one day that I got to clinic 9 o'clock in the morning, and my medical assistant said, Doc, the Hayward Police Department is on the phone for you. And I said, okay. I get on the phone, and they said, Dr. Noha, I have your patient so-and-so here. He has a gun, and there's a whole squad team outside his door, and he's threatening to come out shooting, and the only person he wants to talk to is you. So I got on the phone. We talked about why he, was essentially getting ready to commit suicide by cop, which we've heard before. As one of the types of death by cop, but in our community, but this was one. His children were upstairs. 6 of them, all of whom were also my patients. And they were bringing the hostage negotiation team, and all these people were surrounding his home. So we talked, and I was able to talk him down, and he went peacefully. He then, his blood pressure was through the roof, of course, with all of this, so he then had to go to the emergency room to get his blood pressure under control, and then they took him to John George for a suicide hold, which is supposed to be 72 hours. Next morning, I come into clinic 9 o'clock, and who is in my waiting room? I said, well, what happened? He said, well, the place was packed. There was people in the hallways. The doctor came in the morning and said, who wants to go home? And he raised his hand, and the first stop he made from John George was to come back to see me. I say all of that to say, there's many things I can say about that, but what I'd like to say is that there were a lot of resources spent in that 24-hour period on this gentleman, between the hostage negotiation team, all of these police officers, and half of the Hayward Police Department's outside of his door, then the emergency room visit that was probably unnecessary, and then the John George stay, and then back to me in the morning. And those are resources that were not well spent. They were at too little, too late. And had we had a community infrastructure to handle what are some deep and systemic issues, then perhaps none of that would have ever happened. And so when we think about community, we say that word a lot, we say community a lot. But community to us, and what we've said at Roots, is that a community is one in which the people who live there have some say-so. They have some say-so in the direction of where they're going, in the services that they get, in how their police works with them, how their schools work with them, how their clinics and their hospitals and all their institutions work with them. And we just don't have that. We're losing it by the day. And part of the reason why we don't have that is because we don't have economic power. We don't have economic empowerment. And so this is the reason why we see everybody who spoke, who represents an institution, an organization, a business. Many are black businesses, black-owned businesses who are hiring from in the community, and to the extent that we can make connections with one another and form a service delivery system that is responsive. That word, I like saying culturally responsive, because this is responsive to the needs. This is allowing people to input and give it input and come and say, this is how I want to be policed. We get that there needs to be police, but I'd rather have them walking around in the streets and introducing themselves, or whatever the case might be, right? People need to have an input into the say, into the direction of the services that are being provided to them. And so I think it's incumbent on all of us to make the connections with one another so that we can one day say, we have an infrastructure to support when resources are coming, that we can come forward together as a unified voice and say, these are the gaps, and these are where we think the resources should go to fill these gaps. And that after that, we can be able to say, look what an impact this made. And that is really my vision and my hope, and I believe that this happens with all of us, the steering committee steering this movement, but with others realizing that there's a way to plug in, there's a way to contribute, and there's a way to ensure that we have an infrastructure to deal with some of the disparities and the challenges that today, at this day and age, in this time, are truly unacceptable, and we have to make a commitment to address them.